Good afternoon, I'm Shane Masters with the Midday News. A special welcome if you're watching on onespotmedia.com. The opposition is once again calling for the government to institute a lockdown in areas which have seen a spike in COVID-19 cases. The call comes following the government's press conference yesterday, where the Prime Minister announced an extension of the nightly curfew until March 22. Hospitals out of beds and a positivity rate for Saturday's COVID-19 cases of over 40% is a cause for worry. That's according to opposition spokesman on health, Dr. Maurice Guy. His comments come on the heels of a special press briefing on Sunday where Prime Minister Andrew Holness made this announcement.
So the curfew hour will remain at 8 p.m. nightly to 5 a.m. the following morning until March 23rd, 2021 at 5 a.m.
But members of the public have been skeptical of this measure implemented by the government, as they say it is counterproductive. They say the government should have had some curfews in the daytime, which would be better in curtailing the increasing number of cases of the respiratory illness.
Intention, I think, of the Prime Minister is to reduce the contact time of people with others out there in the community. As to whether this will work, this has to be driven by the data that says that, okay, we have this curfew time, and then we are seeing these numbers in the particular areas that we see the spikes.
Mr. Holness argues that the curfew hours are in a bid to keep productivity going.
Where we have the most production taking place, obviously, would be in the day. Working hours, usually 9 to 5. If you look at our energy consumption, significant energy consumption is in the daytime. Most workplaces and businesses operate in the daytime. So you would want to sparingly use any measure that controls movement during that period of time. Instead, you would use other measures, such as institutional measures, how businesses can operate, and we use situational measures, wearing your mask, social distancing. But in the night, when the general production activities are less, that is when you would seek now to apply your movement measures.
In the meantime, Dr. Guy is calling for the government to once again institute lockdowns in areas that have recorded spikes in COVID-19 cases.
We feel, and we have always expressed as the opposition, that where the data suggests that the spikes are greater, and as it's showing now in the parishes of Kingston and St. Andrew, St. Anne, St. James, and in St. Catherine, our recommendations are that the government should look at geographic lockdowns. Those communities in which, or parishes in which we see the significant spikes, then those are the ones who may, based on the data, be subjected to lockdown.
Oshie. Meanwhile, the opposition says it is now questionable as to when the country will be able to get the vaccines due under the WHO PAHO COVAX facility.
The fact, though, however, is that the minister keeps changing his timetable as to when the vaccines will arrive. And you will recall that the country was told that it was supposed to have been mid-February. And we are only now, or the government is only saving face now, in that the Indians have made a contribution of 50,000 doses, which are to arrive, we are told, on Thursday.
With that in mind, Dr. Guy was asked if he believes the COVAX facility is workable.
Yes, I do think it's workable. The only challenge I have with it is the allocation to the countries, such as Jamaica. And under COVAX, we're only getting 16% of the population, vaccinations for 16% of the population for the year 2021. It's inadequate. But I think it's a system that can work if everyone buys into it.
336 new COVID-19 cases from 3,560 samples were reported yesterday. This represents a positivity rate of 9.4%. Their ages range from 3 months to 97 years. St. James recorded 111 of the cases, followed by Kingston and St. Andrew with 83 and St. Catherine with 54. The country's overall case count now stands at 23,599. The health minister says 264 people have been hospitalized with a respiratory illness. Of that number, 22 are critically ill and 31 are moderately ill. Meanwhile, Jamaica recorded 3 new COVID-19 deaths yesterday, pushing the country's death toll to 425. The number of active cases now stands at 9,405. The blood bank and its partners are trying to increase the blood supply available for medical emergencies. As you'll hear in this report from Cody and Barrett, the commodity is even more critical during the COVID-19 pandemic.
Beds to medical staff, the COVID-19 pandemic has strained every arm of the local public health system, and the blood bank is no different, as its supplies continue to be sapped by the growing demand. It is why a setup like this one at the Vere Technical High School is so critical in topping up the blood bank's supplies. Scores of students of the Vere Technical High School, as well as residents from Hayes and surrounding communities, contributed.
We've realized that the success rate for male students here, they've been giving us a very good helping hand as it relates to blood collection today. The females not so successful, so that's why we are encouraging the males in particular to come up. We usually encourage persons between the ages of, not just young persons, but persons between the ages of 17 to 60. So you have a wide range of persons that can come in and donate. Now, if you're 16 years old, we will accept donations. However, we provide consent forms for your parents to sign, and they can donate at 16 years old.
The initiative in Clarendon was organized by founder of the I Have a Heart Foundation, Abigail Smythe. She urged persons who can donate to go to the blood bank in Kingston, as just 1 pint of blood can save 3 lives.
Personally, I am a heart disease patient, so I know all of the struggles, and one of those struggles is that heart surgeries require a lot of blood, and a lot of times the blood bank is low on blood. So when we do these blood drives now, we keep the blood bank's general supply replenished. And not only that, but blood that is donated also supports and saves the lives of pregnant women, premature babies, accident victims.
She said the aim is to increase the number of blood drives to 63 to 1 in each constituency.
No, we're in the midst of a pandemic. We see an increase of the need for blood. So we try to keep this initiative going. Last year we had 3 blood drives, and for this year our goal is to partner with each member of parliament, and this is our first one for the year.
Cody and Barrett, TVJ News.
Prime Minister Andrew Holness has announced a strict work-from-home order for public sector workers, which will take effect Thursday, March 4. The Prime Minister made the announcement last evening at a media press briefing. Since then, there have been mixed reactions from persons within the labour sector. More in this report.
Public sector entities have been ordered to institute work-from-home arrangements for all staff who do not physically need to be in office. Work from home in the public sector had previously only been a recommendation, but on Sunday, Prime Minister Andrew Holness announced the change. The new order, which takes effect on March 4, has since sparked mixed reactions. President of the National Workers' Union, Granville Valentine, has welcomed the move.
As we reach community spread, I think it gets worse. And I'm of the view that we should have put something, government should have put a policy in place or start working on a policy to be implemented from some time ago.
Mr. Valentine is also calling on the government to implement policies which will allow workers within the private sector to benefit from the work-from-home order.
There's a need for a documentation, a policy to guide us. You're talking about lives. You're not talking just about livelihood anymore. And people are dying and the numbers are going up. We're a very small country and we doesn't have the resources. So I am of the view that we should be talking about policy for everyone, and we are in support. Well, surely I am in support.
In the meantime, President of the Jamaica Confederation of Trade Unions, Helene Davis White, believes that the new measures should also be expanded to include private sector workers. She argues that they share similar risk factors.
For the private sector, it is only something that is encouraged We would have liked if it would apply to the private sector in the same way that it applies to the public sector.
Kodian Barrett, TVJ News.
And it's time for a break here on the Midday News. Stay with us. More stories when we return. Welcome back, continuing the news. The Planning Institute of Jamaica, PIOJ, has indicated that only 36% of the indicators for the National Development Plan, Vision 2030, have so far been met. An update on the plan implemented in 2009 was given at the recent PIOJ quarterly press briefing.
With less than 10 years to go before the culmination of Jamaica's first National Development Plan Vision 2030, things aren't looking very prosperous. While the country has made progress with a number of targets, there has been little or no progress on others. The Medium-Term Socio-Economic Policy Framework, MTF, is the 3-year implementation mechanism used by the Planning Institute of Jamaica, PIOJ, for the implementation of the plan. A new MTF is decided on every 3 years. Director General of the PIOJ, Dr. Wayne Henry, gave an update on the progress of the 75 indicators outlined under the plan at the PIOJ's quarterly press briefing.
36% of the Vision 2030 Jamaica targets were met or exceeded. 26.7% of indicators showed some improvement over the baseline year 2007 towards meeting the targets. 33.3% of the indicators showed no improvement or worsened, and 4% of the indicators could not be compared in this way due to lack of agreed targets for the relevant period.
This is based on data up to December 2019. Dr. Henry indicated some areas of concern as the country works towards achieving the Vision 2030 targets and the Sustainable Development Goals SDGs.
Lower levels of economic growth, increase in the rate of chronic non-communicable diseases, NCDs, a fall in environmental sustainability, and inadequate levels of competitiveness and earnings in key economic sectors.
Dr. Henry says these results will help to guide the new MTF period to run from the 2021-2022 to 2023-2024 fiscal years.
The ongoing implementation of successive 3-year MTFs aim to consolidate the developmental gains made in the previous MTFs and strengthen the foundations for achieving the country's long-term development results, taking into account the many opportunities that surround us, the current developmental challenges we are confronted with, and the global context.
Johan Keys, TVJ News.
The University of the West Indies is looking at a number of measures to boost its revenues. The tertiary institution has been facing financial challenges over the last few years. With the impact of COVID-19 last year, the institution has seen its financial situation getting a little more dismal. It's why the institution has sought to look at a number of initiatives to improve the finances of the institution.
We are going to roll out the global campus. We imagine this could be generating 20 to 30%, if not more, of UWI's finance in the years ahead. If we do this and we do it well, we can be generating millions of dollars, up to 20-30% of our budget, by taking our content, the UWI content, to the world. This is the project that will take our university forward and secure our financials.
According to Vice Chancellor of the UWI, Professor Sir Hilary Beckles, chief among the measures is a private bond.
We will take our reputation to the market and we will be issuing a UWI bond. And so our first project, each campus is told to bring up a bankable project. Each campus, bring forward your bankable project because we are going to the market. We are going to the market for a bond. We are going to be there on the stock exchange. We are going there. UWI is taking its brand to the market. And so we decided that the first bankable project to go to the market is an offshore medical school that will be located at the St. Augustine campus. And we're going to compete. And so Council has approved the establishment of an offshore medical school with permission to go to the market to raise a bond, $60 million bond.
Taxi operators who ply the Waltham route withdrew their services this morning. Operators are refusing to travel on the road any longer without it being fixed. More from Cody and Barrett.
This is a section of the Waltham Park Road blocked with tires by frustrated taxi operators. The deplorable condition of the roadway has cost them a lot to repair their motor vehicles.
Days, weeks, months, maybe a year, this day I suffer. It a mash up the vehicle them, mash up the front end them, man put on brand new front end January. And the same January, the front end them mash up. So we sick and tired of that, brother. We can't go through it every day.
We change shocks 4 times already. We change 4 shocks, that's 2 times already for the year. That's 8 shocks. And 1 shock cost 13,000 for 1 single shock. The front end parts, we can't talk the front end parts because it's very expensive. We have to pay tax for the road, and we can't drive on the road and meet the car mash up.
It's understood that the road has been this way for over a year, and while work on the roadway has started, this section was left unattended.
A couple weeks ago, them start patching the road. Them start from the top part of Waltham and stop right at East Road, right there, so. When them stop right there, so, them pass right here, go all the way down there, so, and start working back again, go right down to the end of Waltham. So what about right here, sir?
In addition to the poor roadway, a drain which leads out to the road has been blocked by debris in the gully, causing severe flooding when it rains. They are calling on the National Works Agency or the municipal corporation to address the issue as soon as possible.
We need the Prime Minister and also respect for the National Works Agency to get involved, to get the road fixed. I have a plan for Yasso, because every time rainfall, there's a flood out. Each time rainfall, Yasso flood, the debris them. So the gully, come out and block the road. Because rainfall is a block. We're tired of it now.
Cody and Barrett, TVJ News.
In news overseas, the U.S. has authorized its third COVID-19 vaccine. This is the one-shot vaccine from Johnson & Johnson. Details from the CNN.
First, it was Pfizer-BioNTech, then Moderna, and now Johnson & Johnson.
It's very good news. Now we have 3 important tools against this virus.
Saturday, the Johnson & Johnson COVID-19 vaccine got emergency use authorization from the Food and Drug Administration. Sunday, the Center for Disease Control and Prevention gave their thumbs up, and by Sunday night, nearly 4 million doses were starting to ship out. It'll start getting into arms as early as Tuesday. This vaccine can be kept at regular refrigerator temperature, and it only takes 1 dose. In U.S. trials, it's considered 72% effective, with 86% protection against severe forms of COVID-19. Not as high as Pfizer and Moderna, but medical experts say you can't really compare them.
It's hard to compare them side by side because they were tested at different times.
Getting a third vaccine right now is critical. In a statement, the CDC director said it comes at a, quote, potentially pivotal time. CDC's latest data suggests that recent declines in COVID-19 cases may be stalling and potentially leveling off at still very high numbers, something other health experts are worried about too.
News in sports. The Reggae Boys will ramp up preparations for a significant year that includes the Gold Cup in July and the start of 2022 FIFA World Cup qualifying with an international friendly against the United States on March 25 in Austria. And that's the Midday News. I'm Shane Masters. Join us at 7 for primetime news. On behalf of the news, sports and production teams, good afternoon.